Welcome to the Green Hour. This is FM91, the Green Hour, every Wednesday here on air and with you on YouTube. Check out our previous episodes on the YouTube channel. We're talking climate change and its effect on healthcare and health. Joining us on this episode, a very special guest, graduated in medicine from Dow University of Health Sciences here in Karachi, completed his PhD in environmental health from Jichi Medical University, Japan. He developed an interest in indoor air pollution and cardiovascular disease and was also awarded a PhD fellowship from the Colt Foundation from the University of Southampton, UK. Dr. Zafar Fatmi has 20 years of teaching experience, delivering courses, lectures and facilitated tutorials related to core disciplines of public health for medical students. Today he is here to talk about climate adaptation and healthcare. Dr. Zafar Fatmi, good morning. What a pleasure to be having you this morning on the show.
Thank you for having me, and good morning and Assalamu alaikum.
This is huge. We're talking about climate change and adapting to climate change and its effect on healthcare. But before we get into that, I'm curious, what is your perspective on climate change right now as we see it?
So you see this climate variability, and now you're seeing in Karachi and all across Pakistan, so you have heavy rain, intense rain in Balochistan and northern areas, and and all over the places. Has been happening, and if you talk to a common man, say, this has happened 10 years ago also, or 5 years ago also.
Right.
But that climate variability occurs every 3-4 years. But climate change actually is a constant increase in temperature and the intensity of these extreme weathers. So the weather events which happens every 2-3 years, you have extreme weather. But the frequency of it and the intensity of it is increasing tremendously and constantly. So when we say change, it has a meaning. So it's not just we use climate change. Climate has variability, but when we say change, means there is a change from the previous years. And years means long time. We're talking about centuries. So in several centuries, if you take about millennium, this increase in frequency of the intensity of temperature and the frequency of floods and other events has not been seen. So that's the change we are talking about.
And we're living through that change as well. We've been sort of kept up to date with what AKU is doing in this sort of environment of change. How is the AKU, the Al Khan University, adapting to this climate change?
So you see, the healthcare industry, we say, or healthcare, these hospitals and healthcare itself generate about 6% of carbon emission globally. So globally means 6% contribution from the healthcare institution itself. Why? Obviously, there are a lot of waste and a lot of energy and a lot of supply chain involved in this. That's why these institutions emit a lot of carbon. So that was realized by Al Khan Development Network and His Highness and the senior leadership of Al Khan University, and they have set a goal of net zero carbon by 2030. So they're saying by 2030 all our operation across the globe will have net zero carbon emission. So that's the goal we're talking about, and we are working around that.
Can you explain, in terms of from a hospital perspective, what is a hospital? What are you facing as a result of climate change and its impact, or the impact that it has had on healthcare and just health generally?
Okay, so let me talk broadly first. So when we say climate change, and the climate change works through 5 or 6 main drivers. So it affects air pollution, it affects water pollution, it affects food systems, it affects vector-borne diseases, and then it affects the social factors. I'll talk about that social factor as well as later. But primarily you see these intense, flooding. So, the flooding leads to contamination of the water systems, contamination, and then vector-borne diseases increase, and all the other diseases increases. So that leads to accelerated dengue fever, accelerated malaria, accelerated cholera, accelerated all those. So what climate does, if I say it is a meta health problem. So whatever the pathway or disease pathways are there, it just accelerate those pathways. So you'll have more of cholera, you'll have more of dengue, you'll have more of malaria. You'll have more of non-communicable diseases. I'll talk about the intimate partner violence. That's the analysis we are doing. Say increase in heat is leading to more intimate partner violence, and that's an analysis we have done, and we have projected that into 2100.
Right. Yeah.
So the social factor, it affects the social factor as well. So these are the drivers through which climate is impacting.
Dr. Zafar Fatmi joining us this morning. We're talking about climate change and the effect that it has on health and healthcare, from extreme weather conditions contributing to mental health to microplastics in the food chain. Everything is affecting health and our health. Dr. Zafar, you're talking about how there's a direct impact and an indirect impact.
Yeah.
Can you sort of extrapolate and explain further?
So when we say climate change, so the first thing comes in mind, heat waves, and so the other thing, floods and droughts, and those other things comes in mind, which is there. And which are the impacts, which we call the direct impacts.
Right.
So if you have the increase in temperature, the weather pattern changes, and you'll have more floods and extreme weather events, and it will affect. But this I call as a tip of the iceberg. We know the iceberg is within. So the indirect impact. So the major impact, which is having the biological processes, the heat, impacts, how it impacting the microflora and the microbiology of each of the system, how it is impacting the ecosystem overall, the microorganisms and all the biodiversity it is impacting, and how it is impacting indirectly to human health, how it is impacting the agricultural sector. The last and the most important, I would say, the social factors. I talked about like the intimate partner violence increasing with heat waves, and we have done some analysis around that as well.
What does the analysis show? Can you tell us?
So the analysis says, we did this analysis in South Asian countries, India, Pakistan, and Bangladesh. What it says that as the heat, so the heat has a direct impact on the frequency of intimate partner violence. And we have projected the data till 2100. And that means as the temperature will keep on rising, the intimate partner violence, the social disruption of the families will increase with time. And it has impact, like, for example, in the southern Pakistan, I have a lot of it's a temperate or lot of hot climate there, but northern areas is less hot, so you'll have more of an intimate partner violence there, and it will keep on increasing. So those are the factors which we don't see. If we have, for example, flooding, so we say, 10 people have died, and that's the tip of the iceberg. But the displacement, but the agricultural disturbance which happens with the flooding, which impacts for longer term, and then we don't see the displacement, the mental health problems, the other social health problems because of the displacement which happens. The education system gets disrupted, the health system gets disrupted. So we don't count those. We say, in this flood in Karachi, 10 people have died. But that's not all. How it is impacting the overall economy. When the 4 days, if the schools were open, children would have been devoid of the schools, so the education system would have been impacted. So our hospital was working at the lowest level because there were very few staff at the hospital. So healthcare systems get impacted. So how many people who are in the hospitals get impacted? We don't count those. So there are widespread impact through this climate change, which will be unfolded, I'm saying, with time.
Well, it's unfolding already, I'd imagine, right? I mean, from a hospital perspective. Is there a plan? Let us say you have a plan?
Yes. So, as I talked about, so there are two things generally we talk about. You have heard about this mitigation and adaptation again.
But I'd love for you to define it. How you define those two terms?
So when we say mitigation, means we are trying whatever we're doing, we're trying to reduce the emission, or we are trying to take out the carbon from the atmosphere, like sequestration. So you're planting trees, so that's another. So any effort which reduces the carbon concentration in the environment, either you don't emit it or you do something to take it back from the atmosphere. So that's mitigation.
Yeah.
But the adaptation is you try to hide from climate change. You try to adapt. Try to avoid the consequences which is happening due to extreme weather, heat, for example, the flooding and all those things, which will impact the health and the economy. So you are making systems resilience and agriculture system resilience, food system resilient, water system resilient, so that the climate doesn't impact as severely as it might. So that's the adaptation. So why we are focusing on adaptation? So Pakistan is focusing on adaptation mainly.
Does it have anything to do with cost?
No. Because we are not a major carbon emitting country. So even if we do best effort, we can reduce 0.5% of what we are emitting globally. In the global contribution, we have about 0.5% or less. So we are not a big country which is emitting. So we can do is we can contribute in mitigation and take their share and reduce whatever have been emitted. We can actually take carbon as a carbon sink, planting trees and all that. But our plan, generally national plan, and also plan should be on adaptation mainly. Because we will have...
It should be on adaptation?
It should be on adaptation, and it is on adaptation. Because we are the fifth, in the rank, which will have the most impact because of our systems. So our systems are weak, and that's why we'll have most of the impact of climate change. And that's where most of our effort should be spent on adaptation. As how to, because we're not emitting anything or emitting very less. So we say, okay, we'll do a mitigation and adaptation, but our main focus should be on.
So that's what the AKU broad plan is: adapt.
Yes, and also they are doing some mitigation efforts as well. As carbon emission, whatever they can reduce. So it's kind of contributing to the global goal. But even if we reduce the 0.5%, it will not have any benefit or very little benefit to Pakistan for that matter. You understand? Because it's a global atmosphere. So if you reduce to zero, for example, net zero, if you're not emitting anything at all, like 20 years down the line, even then your contribution would be just 0.5%. So it will have an impact as it is having now.
So you're saying our goal shouldn't be go net zero? That's not our goal.
That's not our goal for Pakistan yet. Okay. So that's a global goal. That by 2050 we should go net zero, and we have ratified that certainly. But you see, there's a document which is called Nationally Determined Contributions, NDCs we say generally. So these are the documents which have been given to the UN bodies that, see, we are Pakistan and we are going to do these things. So every country, 194, have produced some NDCs.
Okay.
What are they going to do to reduce the emission and adapt? So in that, they have a plan. So we said 50% the reduction in emission by 2030, for example. Okay. But they say 15% will come to finance. 15% will do out of pocket, from our economy, but 35% of that will depend on the funding, on the international funding.
Right.
So that's the plan in NDC.
Yeah.
So we'll come to the financing climate change is another big issue.
Sure.
Which we haven't, global target have not been met yet.
No.
And we are struggling with that. So most of the plan or mitigation plan is dependent on international funding, which we have pledged to the UN bodies.
Climate change and the impact it has and it is having on healthcare and health generally. You spoke just before the break. You touched on finances and how we go to the COP26 and we look at the financial goals, etc. weren't met. A lot of goals weren't met, and we'll leave that criticism there because it's over now. But today, as we stand, we're aware of the problems, as you've pointed out some of the problems, but are we doing anything about it? A, and B, shouldn't we be doing something about it regardless of how much it costs?
So it's a long answer, but I'll talk about that. So first of all, when they estimate 100 billion a year to be collected from the countries who are emitting more, and then again a debate, and they say, see, China is emitting so much, and India emitting so much by the large countries, and then they come back with an argument and say the carbon dioxide which is in the atmosphere, in additional carbon dioxide which is in the atmosphere at the moment, 92% of that was emitted from the Western countries. Only 8% is from the China and India and the emerging economies. So they say, see, so if we are not the contributor, so why should we pay that much? So there should be more money should be coming to those who actually contribute. Have increased the carbon dioxide. Who did the damage? Right. So they should. So that's the debate. But in terms of finances, first of all, we're still not meeting that target, and most of the developing country is dependent. So their plans of adaptation and mitigation is dependent on that money. So if that money will flow, then they'll take those measures. We are also, as I said, that NDCs, we said 50% reduction, and of those 50%, 35% dependent on additional money, which is foreign funding. So how do we tackle this? So this is the situation, but how do we tackle this, and where do we get the money? So there are several avenues. One thing is we're talking about the health co-benefits and co-benefits of working on climate change. So we have produced some estimates. If you, for example, reduce the emission on carbon, then you reduce. So your burning is reduced. So your air pollution is simultaneously reduced. Okay, got it. So carbon emission is reduced. So your particulate matter, nitrogen oxides, sulfur oxides, all the other gases which are harmful for health also gets reduced. Right. If those are reduced, then you'll have a health benefit. So your cardiovascular mortality, your respiratory mortality, your other stroke and other mortality which is due to air pollution will also be reduced. So they say, see, there is a benefit. So if you invest in carbon emission reduction, there is a reduction in air pollution, and there is a health benefit which you have to invest. The country has to invest. If you have more cardiovascular diseases, if you have more respiratory diseases, then you have to invest on those. So why don't you invest in this way and reduce the carbon emission, then you'll have these reduction. So there are several such co-benefits we talk about when you impact. So if you work on adaptation of agricultural system, for example, so you have resilient crop, which is resilient to the heat and other thing. So your production goes up, your water, use gets reduced, and all of that, your energy is conserved. So all of that benefits, overall, it benefits to the economy of the country, if you're talking about.
Right.
So that's the argument people are making, that so climate change is a good investment in that sense for any country. So there are co-benefits, whether it's food system, agricultural system, water system. So if you invest on those, it will pay off in a big way. That's the argument we are bringing to collect.
So why aren't we doing it then?
Why aren't we doing? So it has to spread. So this idea. I mean, only first such a study we did with WHO, Geneva, and EMRO and the country office last year.
Right.
So these studies are very few at the moment. So they're economic studies, and you have to show that how much life you're saving and how much wealth you're saving, and then that the argument you have to make. So these studies are very few in number at the moment, and so we have to spread the word.
Yeah.
So we have to spread the word that even for an industry in Pakistan, for example, if they invest in their resilient system, and if they are prevented or protected from the flooding or heat waves, for example, so they will save. There is a return on investment. We say ROI. So there is a return on investments, but they need to understand that there is a return on investment on that. I'll give you an example. We are trying to develop a project. The motorcycle e-hailers are everywhere. On motorcycles, so Food Panda and this Bikea and all of those people. Right. They're the vulnerable people who are impacted by heat waves. They're the most vulnerable people.
Sure.
They work 6 hours, 8 hours. They are incentivized to work on hard times. They, heat, nighttime, and if it is raining, so you'll get 10 rupees more, 20 rupees more per delivery, for example.
Right.
Again, they're incentivized. And they do that work. Okay? They are vulnerable, but if we say, why don't you provide them a break of 15 minutes, provide them shade, water, and rest. This is the OSHA guideline, occupational health guideline. So if you have 2-hour drive and you have 15 minutes break, your efficiency will increase. That guy efficiency will increase. He'll save his health. So the company the productivity will increase at the end. It's not decreasing. So there is a benefit of health to the individual and to the corporation which are involved there. But you have to bring that discussion to them. That this is what you can do.
When you talk about resilient investing, it sounds like a very long-term thing, and it feels like we're not interested in talking long-term. That's what it feels like.
Yeah, I mean, unfortunate it is, and I'm really appreciating the green hour. We have to do a constant effort. Like a green hour, so it's not just one time you do and get away. So people listen to it if you keep on doing it for a longer period of time. So resilient system, resilient health system, or resilient system overall, you have to keep on bringing that idea and keep on working. And if you have a good prototype working, people say, oh, see, this is working. Then they adapt. Then they, that is replicated. So that's the our and together our goal is we have to produce those prototypes.
Yeah.
So tell them that, see, this works, and it will spread.
I mean, the AKU is doing it. It's investing in this in resilience.
So I'll tell you what happens. So we're talking about net zero and all that, and we said that, see, our main emission is coming from the supply chain.
Correct.
There's a lot of medicine. Waste and everything. So about 75% is about supply chain. So we said, and I'm not the only one, so there's a team working, said all the suppliers, we spread the word. We say, see, you're the suppliers, so you are producing this and you're producing that, but we are talking about net zero carbon, and we are gaining. Because of that, we are saving energy, we are saving, money. So this is the idea, and we have a checklist of an institution of carbon emissions. So if you do this, there's a reduction. So we said that take this tool and use it. So now there are suppliers. Many of the suppliers have started doing that. So it has, one model has been replicated to several others, and if the other institution will take to the next level, so this is how I think our network can increase. So if it's just not AKU, one AKU is not doing it. So AKU is doing it, but the supply chain, maybe 10, 20 institutions involved, and it can increase to thousands if you keep on increasing that network. So that's how I think we can increase the impact, and so we have to keep on talking about this climate impact and co-benefit it has on. So health is generally not a selling point generally for us.
Right.
But for the industry, economy is a selling point. They say, see, your productivity would increase. Your business would be sustainable. That's the selling point for them. And we have to bring that discussion.
We're talking about the impact of climate change on health and on health care. We've touched on a lot of points that include investment and financing, and why is that we're not perhaps looking at it economically right now. We're trying to communicate this as a direct economic impact, and so hopefully things will change there. But what are the implications of climate change for an ordinary person in urban areas and villages, for example?
So that's I say all the time, we keep on talking about global climate change.
Always.
So there's a big, this polar bear is dying, and the glaciers are melting. So the big thing we talk about. As soon as we, start talking about the climate change, so this big things come. And so, polar bear dying, so it's nothing for me. Oh, glacier melting, I am sitting here, so glacier is too far from me, and we have to bring that discussion to the individual. If we want to make a change, and that's where I say localize the climate change, So we have to look at the local impact on the common man, what is happening. Unless they understand it, we will not have, any adaptation. So a common man, for example, a vendor, a thelewala, and a laborer. You talk about agriculture, farm workers. You talk about the construction workers. Ye sare log, these are all vulnerable. Okay, so and their productivity is decreasing. So we have data for that. The farm workers cannot do long hours work now as they were used to work before. So and tell you, those who are in the thick of things, so they're there, they know that it's impacting. So if you talk to the real farmers, really there, so you see, pehle to hum itne ghante kaam karte the, and now we are not doing that much. So they do know that, But we have to bring a solution to them as how they can adapt. What are the adaptation strategies? Do they have, for example, resilient crops? And globally there is a lot of, but we are not talking about that.
Yeah.
We are not bringing it to the farmers.
Yeah.
Similarly, I talked about this e-hailers, for example, is increasing with time now, everything e-commerce and all that. So we have to bring this discussion again, how to improve the productivity as well as, save them from heat stroke and heat exhaustion and all that. How do we do that? And it's a benefit to the individual and benefit to the society and benefit to the industry. So that discussion. Similarly, the construction workers. So these are like hard, but there are some simple things which we can do. As we say, the occupational health and safety guidelines says for heat waves particularly, shade, rest, and water. Simple things. And we talked to NGOs here, and the Silani Welfare, for example. They have 55 centers in Karachi on the roads giving free food, just in Karachi. And they have shade, they're giving free water, free food. I said, why don't we utilize that? So the construction workers, the laborers, or anyone wants to have just rest and water, and so I pass by and say, if even I'm thirsty, I don't take water. So, these are for the poor, and I'm not eligible. So you say, why don't we make a separate corner? This is for common man. This is not for poor, and
मतलब कोई भी आके पी ले
पानी पीने का है, this is just rest and shade and water. So we were talking to them and said, we're open, and that's opportunity. So those kind of opportunities we have to see, and these are our people are very good in that terms. We have charitable organizations, so free food and free water, where you get that? 55 centers everywhere. So why don't we have to utilize that network to the best of our benefit? So we are trying to work with them and provide them. So what will that do if the heat wave come? So obviously you will have less deaths, you will have less exhaustion, you will have more productivity. So that's the
ये कहीं डिस्कशन में और चली जाएगी, लेकिन आप ऑक्यूपेशनल हेल्थ सेफ्टी गाइडलाइंस के बारे में जो बात कर रहे थे, तो सवाल ये है कि क्या ये वाकई में कोई, जैसे हम चेक एंड बैलेंस अक्सर इस्तेमाल किए जाते हैं न्यूज़ चैनल्स में, क्या हम उसके ऊपर कोई are we actually do we have like an ombudsman that is looking at are we implementing these guidelines, because at first sight it doesn't look like it. When you look at some of these people that are out there and who are being directly impacted by climate change, it doesn't seem like anything. There's no guideline. You're on your own.
This is important. There's a term called, I'll bring this also as an environmental justice thing. So we have different socio-economic strata. So there's a lot of informal sector working with no regulation, no guideline, nothing available. So every worker is on their own.
I see.
So there are formal sector, there is an industry and formal industry which comes under regulation and all that. So there's a certain, but the regulation are lax and they're not following that. So we have a bigger challenge for that matter, because there's a lot of informal sector which doesn't come under any regulation. So for industry definition, you have to have 10 employees working for a year and all that. So if you have a mechanic shop, there are 2 people working and they are not on any contract. So it's not an industry, but people are working. So if you have construction workers, 5 people working and working under contractor, It's not an industry. So that's the biggest challenge we have. The socio-economic strata we're dealing with, they are first of all socio-economically deprived, different, but also they don't come under any regulation.
Right.
So if you talk to, for example, so there is environmental protection agencies,
जी.
like say an environmental protection agency and all that.
जी जी सुन चुका हूं उनके नाम
Yeah, सुनी कहानी.
काफी दफा
So and they also should regulate the industries as well.
yeah.
But they are not even able to regulate the formal industries. What to talk about the informal industries? So the again, we have bigger challenge. We have to expand our networking, NGOs and other civil society organizations to have to take that part and bring them, so protect them from the health impact of climate change.
We are out of time, Dr. Zafar, but as a parting gift, perhaps, what can we do as individuals?
Yeah, so that there are a lot of tools on Google and
Yes.
other things which tells you how to reduce. I feel good about reducing carbon emission. For example,
Yes.
I'll give
Yes.
you an example, and that might not. Many people don't like it when I say, can you reduce your eating, meat and this what do you call burger, meat
जी,
burger,
जी.
meat burger, for example. Can you, if you eat 10 meat burger in a year, or more, for example, can you reduce that? What it does, so if you don't eat meat, so it reduces a lot of carbon emission, methane, and I talked about. Okay, can you do that as an individual? Can you reduce the number of clothes you wear to 4 or 5, which you need, not to 10 and 20, which you really don't need? So these are the things. Can you so anything which burns and emit carbon? So can you reduce your carbon emission when you travel, for example, from one place to another? Okay, so how do carpooling and other mechanisms? So unfortunately, we don't have transport in Karachi.
Sadly.
So all of those things we can. So look at your own activity: what you eat, what you drink, what you wear, where you live, your household, what energy you're utilizing in your household. All those are emitting carbon. Okay, and can you reduce it to half? You can calculate, go on Google and say, so I'm doing this, this and this, so your carbon emission at this stage point in time is this much. So you say, let's be my goal in next year that I'll reduce it to half, for example.
Right.
Okay?
Yeah.
And you can feel good about it at the end of the day, and you say, see, I've reduced my emission to half, and I've contributed to the future generation my emissions. So जैसे कहते हैं ना कि आपने अपनी ज़मीन पे बोझ अपना कम कर दिया. So you can reduce your weight, carbon emission, and this is not a big science.
No.
For example, there was in Japan, there was this Fukushima disaster which happened.
Okay.
And they had energy crisis the following year. What they said, see, we'll have energy crisis, so why don't you wear short pants and half sleeve shirts, so then you don't have to use the air conditioner for that year. And they did it. When they are the nation, they did it.
They're very committed.
They're committed.
People.
And they did it, and they reduced the energy consumption to a remarkable level.
Amazing.
And they managed it in that disaster. And they said, we will do it ourselves.
Yeah.
Nobody is coming to Japan and helping us. We'll do it ourselves. So that's the commitment you can do to yourself. Even, for the global climate change, it's not a big thing.
Yeah.
But every drop in the ocean is important. So
I love that. I love that as a takeaway. That what can you do to help yourself?
Yeah.
What can I do to help myself?
Yeah.
I like that. Dr. Zafar, Fatmi, thank you very much for joining us on the Green Hour.
It was a pleasure. It was a pleasure, really. And I really enjoyed talking on this subject, as well as I'm really pleased with this Green Hour that you have.
Thank you.
So it's not just I'm talking here and so somebody else would be talking next week on that.
Yeah.
And that's the constant message we have to give to the masses to improve our situation, adapt ourselves, and do some mitigation. So thank you so much.
Appreciate it. Dr. Zafar Fatmi joining us on the Green Hour here on FM91. Previous episodes are up on this YouTube channel, on the FM91 YouTube channel. Thank you for joining us. We'll catch you next week on the Green Hour. That's Wednesday on air at 10 a.m. But on YouTube, we're up there right now. So have a look at our previous episodes.